Hi, my name is Shana Gadarian. I am professor of political science and chair of the Department of Political Science at Syracuse University. And I'm so pleased to share this research with you that I've been doing in the last year on the role of the American public in the COVID-19 pandemic in the United States. This is joint work with Sarah Wallace Goodman at UC Irvine and Tom Popinski at Cornell. And we've been surveying and talking to a representative sample of Americans since the beginning of the COVID-19 pandemic in March of 2020. I'm going to share some of our insights from that research with you. And this is related to the play that you are going to watch today about vaccines and vaccine attitudes. But we in this project look broadly at how Americans understand and react to this unfolding crisis, and how they use their lens of politics and particularly partisanship to understand and react to it. So I'm going to take you back to fall of 2020 and show you this picture, which looks like a normal kind of White House affair. And what this picture is of the Rose Garden at the White House. And this is the Rose Garden ceremony about the confirmation of Amy Coney Barrett to the Supreme Court. She was very quickly confirmed as a Supreme Court justice after the death of Ruth Bader Ginsburg. And her confirmation, while it was very quick, was very also polarized on partisan grounds. And this White House affair, it looks like a very normal kind of affair, like I said, but it's in fact a very partisan affair, and it's very partisan, and the nomination itself was very partisan. And even over and above the partisan kind of rancor around her nomination, it occurred during an election year, but also during the COVID-19 pandemic. And as we learn later, this Rose Garden ceremony, where there's very little masking during the pandemic, there's very little social distancing, as you can see in this picture, becomes a super spreader event where multiple members of Congress and other kind of leading conservative figures get COVID-19 because of this. So why am I talking to you about this very partisan, polarized event? Because the argument that we make in what is going to be a forthcoming book on this topic is that partisanship is the most consistent predictor of differences in US health behavior and attitudes in the COVID-19 pandemic. This partisan response from the public was not inevitable. It is shaped by the ways that political leaders, particularly the president at the time and the White House, talk about the threat of COVID-19 and the kinds of policies that we need to help fix it. And this partisanship made the crisis worse. The effects of COVID-19 were all encompassing, as you all have experienced, on the economy, on the way we live our lives, on schooling and everything else, but so were the effects of partisanship on those reactions. And other countries, even countries that had deep political polarization prior to the COVID-19 pandemic, have all fared better in terms of how their governments function, but also the death toll in these countries. So perhaps it's not all that surprising that that America did not do as well as we might have hoped in this crisis. We have one of the largest death tolls in the world from the COVID-19 pandemic. There's been massive suffering on many corners of the country. But again, none of it was inevitable that it was going to be as deeply polarized on party grounds as it was, okay? We do have what we call in this book, pre-existing conditions that would have made the response to the pandemic difficult. We have deep political polarization, meaning that both our political parties in the United States are moving further apart in terms of their policy preferences, but also that people more deeply identify with their own parties and increasingly dislike members of the out party. So that polarization occurs before the COVID-19 pandemic. We have a healthcare system that was very tenuous prior to the pandemic, as we are seeing, with not enough capacity. It's deeply unequal based on what kind of work that you have, what your racial and ethnic background is. And that goes with this other inequality that we see in the United States, which is on racial and economic grounds. We are a deeply unequal society. And these conditions made it more difficult for the responses in the public. But we also had a presidential administration who was very focused on the economy in getting reelected. The president was very focused on having the economy look like it was doing well, and also a kind of federal administration that had not a lot of capacity in our bureaucracy in order to help do things like roll out massive testing or masking, and that those bureaucracies were both kind of underfunded, understaffed, and then not up to the kind of need to move quickly in a pandemic. We also had a president who had recently been impeached in the House of Representatives, and while acquitted in the Senate, was not as strong of a kind of politician as we might have had if we had other presidents. So all of these conditions were pre-existing, and then in walks this pandemic. And what we want to understand is, while it was always going to be difficult for the United States to work quickly, to have a kind of just and equal and equitable response, it didn't have to be a partisan response, which is what we saw. And what we do in this project is try to understand the behaviors and attitudes of those early days of the pandemic, but then also how Americans respond over time. So early on, if I can bring you back to spring of 2020, we have a president who is downplaying the seriousness of the disease, which is also being echoed in right-wing and conservative media. So we have a president who is very focused on re-election and keeping the economy running, even as the first COVID cases come into the United States from what seemed like coming from China, but we have evidence now that there were cases that were also coming from Europe. The stock market plunging prompts executive response, and we do eventually see federal action on shutdowns and on propping up the economy through stimulus packages. But the spatial heterogeneity of the pandemic, the fact that it starts on the coast, it starts on states where the president does not need those states for his reelection, where there's kind of conflict between the White House and the governors of those states, means that the president doesn't move as quickly as he might have had we seen the kind of outbreak in rural areas. We don't have a counterfactual. We don't know what would have happened with a different president or had COVID come in different places, but we do know that the response was slow. It was undercut by the White House quite early on, and that there were even conflicts within the executive branch between the White House and the CDC on how quickly to move and whether or not to require that people stay home. So in this very quickly moving, noisy environment that has low and conflicting information, we are interested in how people understood that. And so there's a kind of number of theoretical possibilities that we could have seen. That is, in the public, how do people know what to do, right? They have a president who's telling them, don't worry too much about these COVID cases, they're going to go to zero soon, versus what they're hearing from mainstream media and from the Democratic Party, which is, you should really be concerned, you should stay home. And then how do people decide who to listen to in these early days of the pandemic? Well, it's quite possible theoretically that what people wanted to do was the more risk averse they were, the more worried they were, our theories of kind of self-interest and exposure to the virus would have suggested that people who were more exposed should have supported more protection. They should have, themselves tried to adopt health behaviors that were protective, and they should have wanted more protection from government. Whereas if this is a story where people, instead of deciding about how at risk they are and then deciding what their attitudes are, if this is more of a story about how people use their own identities, political identities, to know who to listen to, then this is more a story of what we would call elite cues in the literature, which is people decide who are the leaders who they trust. They tend to be ones that share their identity. In politics, the identity of partisanship is the most salient. So if we had seen the leaders of both parties and the mass media kind of getting behind one set of policies, that's what we would have seen in the public. But when elites divide, when they decide, when they have different paths, both about whether a crisis is a crisis and then also whether or not what people should do about it, then we should see divisions in the public. And spoiler alert, that's what we see in our data. So we, to study this question, did a survey of 3,000 respondents. We did it through a company called YouGov. They help with academic and marketing surveys. It was a survey that was recruited online, but we use what we call post-stratification weighting to match our surveyed respondents to the census. So they are a representative sample of the United States. We asked them a battery of questions about their health behaviors, about their attitudes and emotions, who they blamed for the crisis, and we asked a lot of questions about the upcoming elections. This work has been funded by the National Science Foundation, the Russell Sage Foundation, our universities, and upcoming the Carnegie Corporation. So we not only surveyed these respondents, one time we actually went back to them. We surveyed them the first time in March of 2020. We went back to them the following month in April, and then following that in June, in August, in October of 2020, right before the presidential election, and then again, basically a year later in March of 2021. So we have 6 time points where we have been following the same respondents, and we can get a very good sense at both what happens early on in the pandemic and then the overtime effect of the pandemic. I'm just going to share some overview of what we found, and this will be part of a forthcoming book if you're interested in more details. So early on, we have one paper that's out in PLOS One, and we look at in the first wave and then every wave subsequent to that, we are asking people about their health behavior. So we ask them on the survey, because of the COVID-19 pandemic, have you done any of these behaviors? And they just check off yes or no. And so we ask them, have you washed your hands more? Have you avoided gatherings? Have you avoided contact with others? So these are all kind of best practices that the CDC was telling people they should do. And this is just the percentage of people who report doing these behaviors. So we can see almost, more than 80% of respondents in March and this is the March 2020 wave, 80% of people are saying they washed their hands more. And that's good, right? That's what we should expect. And then there's variations. There's some people, about 40% of the respondents say they bought hand sanitizer. But what I'm showing you here is just aggregates. I'm just showing you this is the percentage in the whole survey. What we're really interested in is what are the determinants of, there's variation here. Why do some people do this and some people don't? Well, and again, this is a relatively complicated figure, and you don't need to work your way through it. These are more complex statistical models, and we are looking at what is the effect of where you live, what your income is, how many COVID cases are in your area, And we're controlling for all of that. And then also looking at what is the role of your partisan identity. That is whether or not you consider yourself to be a Democrat, a Republican, or an independent on these behaviors. And the reason we do that is because, again, the parties have such different views early on about the pandemic. We're interested in how that filters down to the public. So the way to read these graphs is to just look at, this is the effect of being a Democrat compared to being a Republican. And again, this is like within the same state. We're talking about the similar kinds of policies. People are living in different places, but we're comparing Democrats and Republicans within the same state, independents versus Republicans within the same state on whether or not you're washing your hands more. And then we have all of those behaviors that I showed you before. And if you look down here, this is the kind of at the bottom, this is all of those behaviors. And the major takeaway from this left part of the graph is that Democrats are reporting doing more behaviors that are in line with what the CDC is recommending. This is in March of 2020, okay? Independents all compared to Republicans. And so independents also are more likely than Republicans to say that they're doing these health behaviors. We also asked people to estimate the number of deaths they thought had been from COVID, how worried they are. And the big takeaway on the right side of the graph is essentially Democrats are more worried about almost everything than Republicans, and that they are more likely to, they estimate a higher number of deaths. So they are seeing more risk and they are responding to that risk by becoming more concerned. So, you might be saying, well, there's lots of other things that could be explaining this. Maybe, you told me that cases were higher in places that had Republican and Democratic governors. Couldn't it just be that? And those are all good alternatives. But we have used a variety of statistical techniques and controlled for all of the possible alternatives, and the effect of partisanship essentially never goes away. Okay, so we might think, again, maybe this is just a one snapshot in time, and that in March, because of where COVID was, we should maybe expect Democrats to be more sensitive to it. And if that's the case, then we should see that as we see messaging from the parties switching, that we should see Republicans essentially, so as Republican governors and the president start to tell people to be more concerned, perhaps we would see Republicans change, okay? So it would require a shift in messaging from the parties to lead to change. And that would be the story about elite cues. But if it's really just people like picking up what's going on the ground, it should be over time that Republicans just more naturally catch up with Democrats as COVID moves into their area. So the benefit of having looked at these same questions among the same people over time is that we can actually track that and see whether or not Republicans and Democrats who look different in March of 2020 eventually can converge in their behaviors. And so what this graph is showing you here is the same respondents that we talked to in March of 2020, just the same health behaviors. And we've interviewed them again 6 times over time. And if it were the case that people were just picking up what was going on the ground, and as COVID moves across the country, we should see convergence among these lines. That is, Democrats who are up here on all of these health behaviors should start to look much more like Republicans as Republicans move to kind of catch up with them. And that pattern is not really what we see. What we see is there are increases over time among almost all groups of doing things like avoiding contact with others, buying hand sanitizer. We see people changing their travel plans, but those lines don't necessarily converge. They move in parallel, more likely. So again, what that tells us is that it's not that people are necessarily seeing what's going on around them and updating their views. They are very much taking the kind of cues that are being sent by the people that they trust in their parties. And the Republican Party continues to be not as concerned about COVID-19 as a disease as the Democratic Party. So I'm just going to skip over some of the other things and talk a little bit about face masks. So one of the things we didn't ask about in March of 2020 on our survey was face masks, because there was a lot of ambiguity about whether or not people should be wearing face masks at all. And the CDC messaging was changing over time. At first, we were supposed to be keeping our face masks only for people who worked in the medical field, and then it was, maybe they're not very effective. Federalism means that there's variation in policy state to state and even within states. So local health departments get to decide whether to put on a mask mandate. We see mask mandates come in at very different times across the country, partially depending on the partisanship of the people in charge. And face masks are an interesting case study because they are a major cultural shift in the United States, a place that kind of relies very heavily on the ideas of individualism and freedom to make choices, whereas wearing a face mask is more of a kind of what we might call a communitarian act, which is you sacrifice a little bit of your own freedom to go into a store without a face mask in order to potentially save someone else from getting the virus. And very early on, President Trump undercuts the message from public health officials about masks, saying things like, even as early as April of 2020, when the CDC starts recommending masks, he says he doesn't think he's going to wear one. We very rarely see him in July. We see him wearing a mask, and he calls it patriotic, but more often you see him without a mask, even as he himself gets COVID-19 and is hospitalized because of it, very rarely wears a mask, very rarely advocates for a mask. And even though you see other Republican leaders in Congress and the Senate, this is former Republican Vice President Dick Cheney wearing a mask, that message just is harder to cut through when the president and the media that is aligned with the president says that masks aren't important, or you can choose to wear one depending on what you want to do. So again, this is just a picture of the president coming back from Walter Reed Hospital, from himself having COVID-19. The first thing he does when he gets back to the White House is take his mask off. And so we have been, again, we didn't ask about masks in March of 2020, but we have been asking about it and whether people have worn a mask because of COVID-19 since April of 2020. Again, these are the same respondents over time. And these are Republicans down here. And these are some confidence intervals, meaning we're just giving you a sense of what is the kind of uncertainty around this estimate. These estimates come from models that also account for demographics that might make people more likely to wear a mask, like their gender or where they live or whether there's a mask mandate in their area. So you can see over time, Republicans, again, increasingly wear masks, and a majority of them are saying that they're wearing a mask by the end of our time series, or at least have worn a mask. By the end of our time series in April of 2021, where 70% of Republicans report they've worn a mask versus about 75% of independents, but that this kind of gap that we see early on developed between Democrats and Republicans, where Democrats are 20 percentage points more likely to say they're wearing a mask, just moves in parallel over time, meaning that while everyone is moving to be more likely to wear masks over time, Democrats are still more likely to report wearing a mask than Republicans, even by the end of the time series. And so this fight that we have seen over health continues in various forms all over the country. So whether it's about wearing in the Ohio State House, kind of passing laws that say you can't require members of Congress, members of their state legislature to wear a mask, whether it is places like Texas and Florida who are saying, governors who are saying that school districts can't require masks, which are now being overturned by the courts, or whether it's about vaccines. And this partisan gap that we see very early on in March of 2020 just keeps getting replicated over and over again. So you can see this is, these are not our data, these are data from the CDC, but if you look at what is the percentage here on the x-axis of the percentage of a county that voted for the Trump-Pence ticket in 2020, on the x-axis, and the y-axis here is the percent of the county that is fully vaccinated, there is an inverse relationship there. Places that were more likely to be Trump counties have lower levels of vaccination. And some of that is about the individuals that make up those counties, and some of it is about decisions that different kinds of places make about their healthcare systems and about capacity and access. But regardless, that combination of things leads to states and counties that are more likely to have Republican leadership to have fewer vaccinations, more cases of COVID-19, more deaths from COVID-19. And these partisan gaps are real, and they have been enduring over time. So that's the kind of sad part of the project, and thinking about in part of the next steps of this project, or thinking about what are kinds of interventions and kinds of messaging that might depolarize and depoliticize these very important issues around health and pandemics. Thank you.